We have a long way to go. There's a lot more room for education on everyone's side, but specifically with the healthcare providers. What we're seeing from the OBGYN side is there is a significant increase in depression, as the ALICE data indicates. And so we just have a lot more work to do.
Our intersections are actually the most vulnerable on the planet, right? So like you're looking at somebody, say a Black trans woman, right, who is, definitely one of the folks that's not going to be easy for her to go into an ER, right, or into a doctor's office and feel like she's going to be treated with dignity.
The pandemic really starkly illustrated that for an economy to be healthy, people need to be healthy, right? And large corporations are already recognizing that it's not sufficient for them to just have healthy employees. They need healthy customers. They need healthy distributors. They need healthy suppliers. And they're starting to react to that. They're now, some are explicitly hiring public health expertise into their own ranks. But beyond that, there's a huge opportunity for the business sector and the public health sector to start to collaborate and work together more proactively.
It's not on a patient to come in screaming, saying, treat me properly, treat me like like you would treat any decent human being, treat me how you want to be treated. That's implicit in arriving anywhere for care. It is absolute that a person existing wants to be treated well, whether that's in healthcare or outside of healthcare. And when we're talking about public health, I think one of the things that through the protests of the last year and the social climate really opening conversations, what remains at the forefront of my mind and first steps, next steps, is always to open conversations and to broaden your view. If we're constantly learning, if we're exposing ourselves more, and if we're growing, because the more experiences that we have, the more broad and inclusive our perspectives can be and our approaches to problem solving.